Ladies, sensitive question here. Is your man dealing with low T? He could be going through the male version of menopause. We'll be learning about it. Trust me, you don't want to turn away.
You've reached the age where you learned a thing or two. This is the age of knowing what you're made of. So why let erectile dysfunction get in your way?
It's become one of the new buzzwords, low T, erectile dysfunction. People talking about it all over the country, especially men. Years ago, no one knew what it meant. Well, now the testosterone industry, according to Time magazine, is a $2 billion a year business. Men trying to fight off the effects of aging, insecurity, and andropause, which is the male version of menopause. They're willing to shell out huge dollars to feel and look better. We're joined this afternoon by Dr. Angela DeRosa. She's an internal medicine doctor and an expert in hormonal health. Good to see you.
Likewise, thank you.
All right, so there really is such a thing as menopause.
There is, actually. We look at menopause in women. There's an equally important aspect with men called manopause or andropause, which means low T, testosterone.
And men don't get the hot flashes, but what do they get?
Well, they get young girlfriends and motorcycles, but no, really, they get they can get man boobs, as we call it, the gynecomastia. They can have hot flashes similar to women, but more importantly, they get fatigued, mental clarity starts to drop, irritable, lack of patience, and low libido.
I've checked off almost every one of those. Listen, how does a guy know that it's not just I'm old, I'm not feeling good today, versus I have low testosterone?
Well, all guys are going to age, and they're all going to at some point develop testosterone deficiency because Mother Nature is going to slow down as time goes on. The degree of severity depends on how old you are, things you may have done to your body in the past. But we're going to look at blood levels, we're going to look at symptoms. Certainly if you have low libido, you're gaining weight, your cardiovascular disease risk goes up, and most guys, usually when they're in their 50s or 60s, are going to start to exhibit those symptoms.
And realistically, if a man goes on some sort of hormone replacement therapy, similar to what women go on, what can they expect realistically?
Usually they get an improvement in energy, their mental clarity perks up, they're not as irritable, their libido may start to kick in, the plumbing might start to work better than it had previously. But most of all, they also start to lose weight, which decreases their risk of developing diabetes, high blood pressure, and coronary artery disease.
And I'm assuming that's if you go to a doctor, but what about all these over-the-counter testosterone supplements? Is there a danger there?
Well, there absolutely is, because first off, you don't know what's in the products. There could be things that are not good for you, but also most of those products aren't going to work. You need to have pure bioidentical testosterone administered by someone who knows how to do it properly and safely, because guys always they think more is better, and more is not necessarily better.
And real quickly, you treat men and women. Who are the better patients?
Oh, actually the men are actually better because they're comedic relief in our practice.
Yeah, well, you heard Lynn Sue cackling over there when you mentioned some of those symptoms. All right, doctor, good to see you. Thank you.
Thank you.
Thanks for coming in.